Recently, I've been having a lot of abdominal pain. I was very concerned because since 2023, I've had an ovarian cyst. However, the ovarian cyst was not very large. It was only 3.5 centimeters in diameter. Now, I was very worried that this increase in abdominal pain might have signaled that my ovarian cyst has grown. So I went to my primary care provider and asked for an abdominal ultrasound. My primary care provider scheduled me for an abdominal ultrasound. I went to get the abdominal ultrasound, and I have now gotten the results of the ultrasound. Unfortunately, my ovarian cyst has grown, and it is now 6.2 centimeters in diameter. This is most likely why I've had an increase in abdominal pain. Now I'm faced with the choice of having surgery. I usually do not like surgery. However, I have a very long history of endometriosis and developing ovarian cysts, which can grow to be quite large. In 2022, I had an ovarian cyst, which was 14 centimeters in diameter, which needed to be removed. And previously, I also had another ovarian cyst, which was much larger than that, and it ruptured and it caused a lot of complications. So with this all in mind, I now need to think about the surgeon I want to do my surgery, and I have 3 surgeons in mind. So this is where I need your help. Now, after listening to these 3 surgeons, let me know which one you think I should choose. I really appreciate your help. I am quite confused right now as to which surgeon I should go with. So let's get started. Surgeon number 1. Surgeon number 1 is a phenomenal surgeon. He has fantastic skills. He successfully removed my ovarian cyst in 2022, and I was very grateful for everything the surgeon did. However, I have a few reservations about the surgeon. First of all, the surgeon is not always forthcoming. Things happen during and after my surgery, which did not require any explanation, and the doctor decided to try to explain some things, and it ended up we found out he caught himself into some lies, and they were not big lies, and actually they were really stupid lies. But it made me start doubting how much the surgeon was telling me. If he was lying about little things, maybe he was lying to me about bigger things. So this cast a lot of doubt on the surgeon. Also, about a month after surgery, I started having increased abdominal pain. I was really concerned the ovarian cyst had come back, and the surgeon just told me, "Oh, no. You are just recovering from surgery. Pain is expected." Well, it ultimately ended up that I had another ovarian cyst, which came back and it ruptured. It caused a lot of pain, just a lot of misery, and I really wish the doctor would have taken me seriously instead of brushing me off and telling me no, it was not another ovarian cyst. So that's doctor number 1. Very good surgeon, excellent skills, was able to successfully remove my ovarian cyst. However, he was caught in some lies. He was not very forthcoming about things, and then also he just brushed me off after surgery. Doctor number 2. Doctor number 2, I have never seen before. However, he has been recommended to me by some people who have endometriosis. He is supposed to be a very good surgeon. The one thing that I have an issue with is he practices at a hospital that I have not had good experience with. Previously at this hospital, they were very dismissive when I came in and I was very sick with pneumonia. They told me I was not sick. They sent me home. And then 2 weeks later, I nearly died from a severe infection in my lungs. I was in and out of the hospital for the next 2 years because they did not properly treat my pneumonia. I had a lot of complications, and ultimately the hospital basically said I was making everything up, and I was dropped as a patient. Now, going with this surgeon, there is a big possibility he will have access to those old medical records, and he might just completely dismiss me or might not take my concerns very seriously. Also, if I have to be hospitalized after having surgery, there is a big concern that these medical records might resurface and they will not take any issues that I have after surgery. They won't take any of those concerns seriously. And they also may not manage my ventilator because they might think, you don't really need that. It is just for appearances and we're just gonna take that off of you. Yes, if they do that, I will die. So that is a big concern with surgeon number 2. So just a brief recap, surgeon number 2 is a very good surgeon. He's come highly recommended. However, he practices at a hospital that I have not had a good track record with. And furthermore, that hospital does not like me. So it would probably be best if I'd never see that hospital again. Doctor number 3. Doctor number 3 is a phenomenal surgeon. She's come highly recommended, and I really think she will be an excellent surgeon for me. However, there is a huge drawback. She is located 10 hours away from my home. Now, this is going to be a big stumbling block for me because that is a very long ways to travel. It is going to be very difficult after having surgery to travel 10 hours back to my home. There is a possibility that we could potentially fly there and see the doctor, but then there's just the complications of flying and getting all my medical equipment there and then not knowing exactly when I can fly home because I might be in too much pain afterwards to fly home. So we might be better off driving because if I'm in too much pain, we just stay at a hotel until I feel better. Then we drive some more. And then if I'm in too much pain, we stop and we keep going like that. But with flying, it's just get on the plane and fly. And we don't care how much pain you're in because we are not getting off this plane till we land. Also, another concern is I've never been to this hospital. Now that might be a blessing. So they might just look at me with fresh new eyes and be very willing and accommodating to all my needs. But they also might be really frazzled and not willing to work with me because if they don't know anything about my medical condition, they might be overwhelmed that I might have a lot of complications, which can happen with mitochondrial disease. However, whenever I've had surgery, I've never had any complications from anesthesia. I've just had the standard pain from the surgery. So that is a little bit of a concern that this doctor might not be willing to do surgery on me because I have a mitochondrial disease and also I have a tracheostomy tube and ventilator. And then there's also the concern that the hospital might have some complications with me having a tracheostomy tube and ventilator, again, because I've not been there. So I don't know how this would all go simply because I am not familiar with the hospital. So that is doctor number 3. She is an excellent surgeon, but she's 10 hours away. That poses travel complications. Either I'm going to have to fly or it's going to be a very long drive to and from the hospital. And also I've never been to the hospital, so I do not know how they will manage my ventilator after surgery and also how they will manage my mitochondrial disease. So those are the 3 doctors. So let me know which doctor you think I should go with. Doctor number 1, excellent doctor, but had some issues before and after surgery. Doctor number 2, excellent surgeon, but works at a hospital that I've not had a good track record with. And doctor number 3, excellent surgeon, but she's 10 hours away. And then also I've never been to that hospital, so I have no idea how they're going to manage my ventilator and how they will react to me having mitochondrial disease. So thank you so much for joining me. Please remember to like and subscribe down below. Please also remember to comment and share. It really helps my YouTube channel. I hope you have a great day and a wonderful week. Bye-bye.